Welcome to Mental Health, the crisis of our time. My name is Ann Bergen. I'm the host of this series of programs brought to you by Franklin TV, whose mission is really to make the community aware of pressing issues that impact its citizens. And of course, one of the biggest issues is the mental health crisis. As a former elementary and middle school principal, my focus has been on early intervention and prevention regarding issues related to mental health, because too often when left unaddressed can lead to alcoholism, prescription drug use and other drugs, cutting, overeating, gambling, excessive screen time, and suicide too often when life becomes too painful. I have lost so many former students to overdose, suicide. Too many veer off the path of fulfilling lives. But mental health is taking its toll not just on adolescents and young people. It spans all ages and all socioeconomic levels. 1 in 5 unhoused live with an underlying mental health condition. People 85 and older have the highest suicide rate. Alcohol and prescription drug use and misuse is increasing dramatically among senior citizens. 1 in 4 veterans struggles with mental illness. We have to come together to address this national epidemic. So it is my great pleasure to welcome our state rep, Jeff Roy, today to really kind of let us know what's happening at the state level and what's happening to address sort of the pain and anguish that's associated with mental health. And so I'm going to start. The first question I wanted to ask you is from your perspective, how seriously is the mental health crisis being taken at the state level, considering the toll that it's taking in so many ways, including, economically? I was just curious, what's your perception of, of your work at the State House? It's
an incredible part of the conversation that takes place at the state level each and every day. In my role, I'm a energy and climate and utilities chair. Okay, but I don't lose sight of the fact that the issues affecting climate change and global warming have an impact on the psyche, and mental health issues even come up in that context. But we have, in both the House and the Senate, and as a joint committee, we have a committee that's devoted to the topic of mental health and substance use. And that committee hears all of the bills that are related to those particular subject matters, is involved in the advocacy for the state funding that provides all of the programs at a state level, and oftentimes hears incredibly compelling testimony from people across the Commonwealth, all 351 communities, who come in to talk about the mental health issues, whether it's in the schools, whether it's in emergency rooms in hospitals, whether it's insurance companies are providing adequate coverage for mental health services, what support services are out there both in the schools and in mental health settings. So it's incredible, the context and communications that happen along this route.
Because one of the things I was going to ask you is that in my interviews with from the Senior Center, from veterans, and just interviewed a couple of the co-responders, the mental health clinicians with the police department, and the same issue keeps surfacing. One of the biggest concerns is housing, that is doing people in. They cannot find housing. I was just wondering how big an issue that is. How is it? I mean, we know it's a big issue, but I'm just wondering, how is it being addressed? What are your thoughts on that? Or
well, on the housing piece,
the housing part.
Sure. For the first time, and the legislature had to approve this change, Governor Healy has a cabinet-level secretariat for housing alone, and that just happened this year. To further bring this home, the new housing secretary is Ed Augustus.
Oh, that's right, from Dean. That's right, yes.
He's taken on this extraordinary challenge, and a lot of work is being done at the state level to push communities into getting more affordable housing in their communities. I mean, here in Franklin, you may have noticed a few apartment buildings going up along the way. That's a part of the solution, although I dare say that the apartments that are going up around here would not fall into the category of affordable.
Well, no, they're extraordinarily expensive.
It's
right?
incredible. It's incredible. But there's more of a push for public housing. We have incredibly long and high numbers of people on lists waiting for public housing. My office spends a great deal of time dealing with people who are either suffering homelessness themselves or have a family member or a friend who's suffering homelessness, and we try to coordinate them with the appropriate state agency to give them some help in finding housing. And you know that we have a crisis on our hands with migrants coming in, and they're getting emergency relief, and we are so swamped with housing needs that these folks are being put up in hotels in the Commonwealth of Massachusetts.
It was a terrible problem before, and then you compound it with that situation. It's really,
and I think everyone would agree that a house or a home, be it a single-family house or multi-family house, a condo or an apartment, is so essential to living.
Absolutely.
And someplace that you can put your jacket, take your jacket off, have a bed to lay in. We take that for granted, but there are people who don't have these things, and you know, part of our role in government, and I know some people do not like government getting involved in these issues, but part of our obligation as human beings and as government officials is to provide, help people help themselves in getting into some sort of housing so that they can get back on their feet and get back into the regular flow of a community is essential. And you know, we see that obligation and we try to meet it. Are we successful 100% of the time? Of course not. Right. The resources that are necessary to do this are incredible, but we do our best. And you know, with all these struggles, we end up with a mental health crisis at the same time.
That's right.
And that struggle for housing contributes to make this crisis even worse.
Absolutely. And the other thing, again, from listening, you know, across from the schools, the senior center, veterans, in terms of the wait list for services for any kind of mental health, you know, the 8-month wait list for adolescents to get help, the seniors looking for help, veterans wait lists. Is that part of what's being addressed as well?
Yes.
Yeah.
And, you know, unfortunately, we've had some communities that have embraced zoning codes that make it virtually prohibitive to develop affordable housing. I hate to say it, but there are folks out there that do not want those people in the neighborhood.
Not in my backyard.
And you know, it happens in most functions.
Does the state, and and again, I'm not expecting you're going to have all the answers to all these kind of things, because your area of expertise is fine-tuned in the House, but in terms of getting funding for communities so that they can, one of the things, and you and I have talked about this before, is that it's always the schools are going to fix everything.
Of course.
Mental health crisis.
That was your job, wasn't it? All of those years, is to fix all these problems.
Right, it's like the schools will fix it. Give the money to the schools. They'll take care of mental health. Not give the money, but I mean just give the problem to the schools. But it's a community issue. It isn't. The schools cannot do it all alone. But I was just wondering if is there funding that comes into communities so that they can, in fact, set up community resource centers and have social workers for the community, so everything isn't in the schools. I was just curious what you thought about that.
You know, we do spend a great amount of money, hundreds of millions of dollars on mental health issues. And a little fact that a lot of people don't know and have struggled with is 40% of our budget is in the healthcare and human services area. So that poor secretary, that job occupies 40% of the budget.
Yeah.
We had a great secretary under Governor Baker, Mary Lou Sutters, who served the entire 8 years of that administration. She was so good that Governor Healy wanted her to stay on. But 8 years controlling 40% of the budget, and she had to make some decisions that were not always popular, but she was committed to the task. I still see her on a regular basis, and glad that she's not leaving the field. But I do have some statistics on the numbers that we spend. So on child and adolescent mental health services, is $120,604,949. Adult mental health support services is over $600 million. And these, I could go on. I have a list, 2, 3, 4, 5, 6 pages of line items in the budget that are dedicated in one way or other to mental health services. Some of those services would come in the form of earmarks. For example, in Franklin, we earmark as a line item in the budget $50,000 a year to the SAFE Coalition, which is doing some great work.
Right.
And over the last 7 or 8 years, we've generated $400,000 for that organization, which you are well acquainted with, and thank you for your service to that organization. But that's another way beyond what we do with these particular line items and these particular agencies. We also have earmarking functions that an individual state representative could do. And I do recall, and even Franklin was in this position probably 20 years ago when they eliminated the social services staff member who was on the local town budget. I don't know if we'll move back to getting those positions in place. I think a community like Franklin is relying on groups like the SAFE Coalition, the Interfaith Council, and some of the other community groups to step in where it can't take on. But I'd love to see a social services role back in the community.
Absolutely, because it's, when you think about all the mental health issues, and that certainly SAFE can connect people to resources, but they need the resources to connect them to. They need to have more counselors available, and the especially adolescents. Work with adolescent groups and things like that. But that's on your radar in terms of, and I hope also that the town can will consider adding some layer that isn't just in the schools. It's a lot, but yeah.
Let me share with you something that was extraordinary that we did in the last legislative session, and it was August 10th that Governor Baker signed the ABC Act, which was a huge mental health overhaul bill. It didn't get a lot of attention when it was signed, but it's an extraordinary piece of legislation, and let me just share with you some of the things it does. For example, this particular bill guarantees everyone an annual mental health wellness exam. So like you go annually for a physical exam, now health insurers are mandated to provide folks with a mental health exam. Let's catch this disease early, see if there are some early interventions that can help people, and doctors can identify.
Would someone have to ask for that? In other words, do people going in to their primary care physicians know that this service is available, or do they have to wait for the Well, I suppose that the doctor would determine.
Hopefully
Yeah.
most of your primary care physicians are asking some of the key questions already. Those have been in place
Yes,
forever.
like they say, are you depressed or have you, that's right, that has been built in.
So that's been there.
Yeah.
But now, letting people know that, hey, you can get a free exam for your mental health condition. Whether people will take us up on that is a question. How many people want to subject themselves to the stigma associated with it? So we have to erase the stigma. So that's one good thing. Another piece is enforcing the mental health parity laws.
Yes.
Treating mental health wellness just like physical wellness, and making sure that insurance companies cover both.
Was that Patrick
equally.
Kennedy's big initiative back in the day? I know he was a big parity person there. Yeah.
So we implemented that as part of the bill.
That's great. Yeah.
We also included a number of initiatives in there to address emergency department boarding. And I spent a lot of time over at the Milford Hospital meeting with physicians and the president over there, and actually remember them taking me on a tour of the emergency department and showing me, not identifying patients, but young people who were in the emergency room because there was no other place for them to go. There was no facility
there you go. That's
for
a huge
them
problem.
to take place. So we created online portals that provide information real time on the availability of beds so that emergency room physicians don't have to make 10, 20 calls to try to identify a bed. They can get that
That's pretty cool.
information. Yeah, it's and we also call on the Health Policy Commission to do some further investigation and prepare a report on any further things that we need to do to eliminate the boarding. I've heard that it's making an impact, and so we've got some success there.
That's really good, yeah.
We created the 988
yeah.
helpline.
How is that? Because someone was saying that that's inconsistent results with that. Are you seeing that improved along the line?
I'm seeing that improve
Good,
because
good.
we did
That's important,
an implementation of that program, and also expanding the ability of 911 dispatchers to handle these types of cases. We put in place red flag laws and extreme risk protection orders so that if somebody's having a mental health crisis, they can communicate, a family member or a friend or a doctor can go to the police to have weapons removed from that person struggling with mental health issues. We have red flag laws in place, and this really came home to us when the shooting took place in Lewiston, Maine.
Yeah.
And that stands out in my mind because I don't know if you know, but I went to Bates College.
Yes, of course. I thought of that right away. That's right. I thought about that right away. Yeah.
You know, that really hit home because where the location of these shootings was the campus was right in the middle, and we're sitting there shocked that it didn't take place. But they did not have these red flag laws in place. And you read about family members who were telling folks that the shooter had mental health issues. His military co-workers were saying that the man had mental health issues, but they didn't have laws in place to take away the weapons from this individual. We included that.
That's great.
In this particular bill.
Is this all part of the ABC one?
Yes.
Yes. Wow.
One bill.
Yeah, one bill.
One bill signed in August of 2022 when everybody was out on vacation and sitting at the beach. So I won't go through every provision, but let me see if I can find some other. We wanted to expand access to the evidence-based collaborative care model, so that gives more training in that particular area and gets folks out in state contracted plans or commercial health plans to know what programs they should have in place, reviewing the role of behavioral health managers, and that directs again the Health Policy Commission to study and provide updated data on the use of behavioral health benefit managers by insurance carriers, and make sure that they're not eliminating or limiting the ability for people to access mental health care. We have a law in there for CHIA, which is the Center for Health Information and Analysis, and then they need to collect data on the delivery of behavioral health services to establish a baseline for spending and giving us an idea of where else we have to go. We establish an Office of Behavioral Health Promotion, and that's under the Executive Office of Health and Human Services. Increasing care in geographically isolated areas, enhancing school-based behavioral health services and programming, increasing access points for youth for effective behavioral health treatment, expanding insurance coverage for vulnerable populations.
That's crucial.
You know,
crucial.
And allows for interim licensure of licensed mental health counselors. So we need a lot of those.
That's very good.
You know,
that's
so
one of the big issues.
Right. So let's move them in, and updating the Board of Registration of Social Workers. So this all under one act.
Yeah.
And you know, we're taking this matter seriously, and this was put into place in the law was signed in 2022, so takes effect in January of 2023. We've had a year operating under it. I've heard of some improvements. I've also heard of ways we can continue to work on this, and we will.
It's a huge start.
Yeah.
Huge. No, that's good to know. That's important for people to know that. And so one of the questions I was going to ask you was about, we've lost a number of young people and continue to accidental overdose because of fentanyl, and even now some more powerful ones showing up starting in Rhode Island. We're seeing them coming our way. Can you speak to what effort has been made relative to keeping fentanyl out of our country?
Yeah.
Of course, that's not your issue.
Again?
I wish you could solve it for us. But
certainly do. I mean, that definitely is an area we could use some help from the federal government. But all I can see down in the federal government is people tripping over themselves.
It's not good.
And you know, no efforts to really address the concerns that are really hitting home. But just means that the states have to work a little harder.
Yeah.
And thankfully, the United States is made up of a union of 50 states, and a lot of these issues have been pushed to the states. So, you know, ramping up our efforts with policing and our district attorneys to prosecute people, making tougher laws for those who peddle in drugs like fentanyl, giving more resources to our police departments to have social workers in place to identify these crises, providing more support services to individuals who are in recovery. And you know, I'll put in a plug in. I went to visit the folks at Gilly's house yesterday, and I don't think I have to remind people that we did not have a home for people in recovery in this geographical area. They're filling a need there, and I was talking to them about other issues that they could use some help with. But you know, putting all these resources in place is part of the answer to the puzzle that we have with substance use disorder and fentanyl, which is simply making it worse.
Well, that's the thing, because it's just people that aren't aware they're ingesting it and they're dying. You know, it's the saddest thing, you know. But it does speak to the need for, what I'm seeing though is more of the recovery intervention programs like Turning Point and Chris's Corner and I don't know if it's Milford or, but a lot of these place is coming into fruition, and they're really helping a lot of people.
Yeah.
There are more of those resources out there,
Right.
which is
well,
really
well,
good.
the SAFE Coalition is a perfect example. I hate to remind people, but in 2015, nothing like that existed.
But that's why because I don't want to flatter you or anything like that, but when you think about, and I think about it all the time, and you and I have talked about, it's just that you and Jen Knight together got that thing going.
Yeah.
And you look at what it's become, what you guys started.
Yeah.
And then you fight for funding for it, to get that $50,000 line item. And then you look at the family support program that Jim Derrick has started, and the number of people that need to be, have that attention, family members that are living with this. It's pretty incredible.
I say often to both Jen Knight and Jim Derrick, who were at the real ground of building this organization, and I remember Jen first coming to me and said, I'd like to have a group in the community where people could come and have some folks who they could talk to, and it was a meeting once a week, and I now see what she has done with the organization, and I say, Jen, is this what you had in mind? But it was grown out of the need and grown out of the community which came together to embrace it, and it came from those people who are hiding in the shadows, who saw that they weren't alone, and then they all came out to help one another. And I really say, to me, it was a constellation of the stars. The right people came together at the right time to do the right thing. And today you're the president of the organization.
But I'm telling
Did you say that's where you would be in 2015?
No, but it's just when you think about that's it. And in talking to the clinicians today from the police department, they were talking about Franklin as this community where people all coming together, the food pantry, the Interfaith Council, SAFE Coalition, and what an incredible community it is. People all working together,
And that's what we need.
Yeah.
That's what we need for a crisis like mental health. You need a community. Everybody needs somebody.
Right.
We're not self-made people. We've had the benefit, of an education in a public school system that was provided by our government. We drive around on roads that were provided by our government. We have, a great town to live in, thanks to a great local government. And that's what makes a community. And I think people flock here and thrive here because of that. And it's nice for people to know that there's somebody they can turn to in a time of crisis.
That's right. And before we came on air, we were talking a little bit about this whole crisis at the national level around getting things done, and our institutions may be crumbling a bit, and belief in democracy. But you pointed out, not at the state level, is it?
No, no.
Yeah.
Again, going back to the point that we have 50 United States, and each of the states has their own government set up much like the federal government to address issues that were reserved to the states by our founding fathers. But failure on the federal level has led to more issues going to the states. And I think the states, and I'm biased, I love Massachusetts. I love what Massachusetts has done. And I wake up every morning grateful and pleased that I live in the Commonwealth of Massachusetts, because I think we have done and taken on these issues that have been thrust upon us.
Right.
And I think we've addressed them very well. Could we do better? Of course we could do better. We can all learn from our mistakes, but we're taking on these challenges and addressing them in the best way we know how.
And I just had one final question, that just because in my work in education, one of the concerns that I've had for a long time is that the idea that there's only one path for young people to take, and that's the traditional 4-year which ignores the strengths, interests, and passions and needs of our society. It limits kids, it makes them very unhappy, and we're losing them. It becomes a source of mental health issues because they're just not feeling any sense of autonomy or control over their own lives. I was wondering if you could speak a little bit about, I know you do a lot of work around, can you speak about like the whole credentialing program?
Sure.
And talk about that a little bit.
I mean, education is what drove me to get in government. Mm-hmm. And I always tell people, well, I live in the community where Horace Mann was born. Who should do education better than us? We have an obligation to this man who set the foundation, or built the foundation. And education means something different to everyone, and we all have different interests, and we all have different ambitions, and we have different abilities, different skill sets, and we ought to be able to address those different skill sets and ambitions in ways that allow people to find their path.
That's it.
And we need more plumbers, we need more electricians, we need more carpenters, we need more skilled workers in the manufacturing field. We need more college-educated kids, there's no question about it. 72% of the jobs in the Commonwealth of Massachusetts require some credential beyond a high school diploma.
Right.
So, but it doesn't always require a bachelor's degree.
There you go. That's the misconception right there. Yeah.
Well, one of the pieces, and you talked about the credentialing program, one of the pieces we included in our offshore wind bill in 2022 was a credentialing program, and it's a pilot program addressed to the offshore wind industry. Okay, we're creating this new industry in the United States of America.
Yeah.
And Massachusetts wants to be the place to anchor in the offshore wind industry. And just last week, we hit first power in the United States. The first of the turbines to generate power sent 5 megawatts of energy to the grid, and that's the first of 62 turbines. So there's a lot of jobs in that industry, whether it be working on the turbines, building the component parts for the turbines, operating the ships that go back and forth, working in the manufacturing facilities that are going to make these parts. So many jobs, some of the jobs that we don't even know what they are.
Exactly, right.
So we created this credentialing program in the offshore wind bill that's targeted specifically to traditional high schools. So we need workers in this space, and to get young people excited about the opportunities in offshore wind, we are saying to school districts throughout the Commonwealth of Massachusetts, for every credential that you offer, and you have a course, and at the end of the course, the student gets a credential. For every credential you produce, we're going to give you $750. So if you've got a classroom of 20 kids, and over a course of 10 weeks you get them a credential, you're going to get $15,000. And if you do that 3 times a year, that's $45,000. And that's a way to introduce folks to the opportunities in offshore wind.
Wow.
It's a way to get money to our schools, and it's a win-win. In that pilot program, we put $3 million into it, and we have the Department of Labor working with the Department of Elementary and Secondary Education to implement this and make it work. And I think it's an exciting opportunity, and we have to do, it's a pilot.
Yeah.
And if we're successful here, we can do it over and over.
Wow.
And we've got Tri-County building a brand new facility.
That's right.
The voters supported it. I was out there on Friday with Congressman Auchincloss, seeing what they're doing now, and seeing that they're offering some great opportunities for these students.
16 different pathways, career pathways, at least 16 or 17 now, in terms of what, it used to be just, woodworking, and when you listen to what they're doing at that school,
yeah.
it's
How
incredible.
much did you pay your last plumber an hour?
Yeah, no kidding. We just paid for it. We just paid for. Well, our water heater went. It was $2,000.
$2,000. So you know, it's a great opportunity for somebody who wants to use their hands.
That's it.
And does not want to carry student loans. There are so many great pieces about it. We also have to convince the parents.
But that's it. We have to take
these are opportunities.
There's such misinformation about that. The only way kids can be successful is, they do need something post high school, but it doesn't have to be that you have to go and to the traditional 4-year. If we can change that stigma that parents think that my kid's somehow going to miss out, no.
I'll tell you a program that I've been struggling to get the folks at UMass excited about. So I also chair the manufacturing caucus in the House of Representatives. So I've talked to UMass. I said, why don't you provide a manufacturing credentialing program at all of your UMass campuses so that the parents can get their UMass sweatshirts and T-shirts and bumper stickers, and the kid can go for a year or two and walk out of there with credentials and certificates that will give them the skill set they need to succeed in manufacturing. We have 10,000 jobs that are available today, and we need skilled workers to do it. You can contribute, and you know, everybody can say, hey, my kid's going to UMass and is coming out with a manufacturing certificate and program.
That's pretty cool. And you know what else is cool too, and I know you know this because you and I have talked about, is what's happening at the community colleges as well.
Absolutely.
Unbelievable. And we've got to get that information out to parents too. There's great pathways that fulfilling jobs and it's all good. So it's good.
How's that?
You got a lot of work on your plate there, buddy. But I do want to thank you so much. I know you were busy. You came from the State House and you came here and gave time to do this. So I really appreciate it. And all your service and all the things that you do and contribute and help us out in so many ways in Franklin. And you represent Millis or Medway?
I represent Franklin, all of Franklin.
All of Franklin.
And precincts 1, 2, and 3 in Medway.
Medway. I keep getting the M's mixed up.
Most of Medway, and still absolutely enjoying this job beyond belief. So thank you.
Thank you. And I want to thank everyone for watching. Again, this is Mental Health, the Crisis of Our Time. I'm Ann Bergen, and thank you. And I want to thank Chris Flynn, our producer, and we'll see you next time.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.